Hi, Derek Mahony here. I'm very pleased to announce that for the first time ever, Professor Wan Moon will be coming to Sydney to do a one-day course, which will be theory and hands-on practical. In the theory, Wan will discuss with you which cases this technique would work the best for. In my hands, an adult who has a narrow palate, has airway obstruction, doesn't want to undergo a classical surgically assisted expansion. Children, high palates, cross-bite, where I want to improve the nasal floor. What you've got to understand about Wan's technique, by getting 4 TADs up near the nasal bone, we are able to change the palate from that dimension to that dimension, and it makes a huge improvement in their airway. This is a technique I think a lot of your adults that show up for snoring, sleep apnea, many dentists don't get it. They just give a patient a mandibular repositioning appliance hoping that all the problems are base of tongue. Half the problems are up here. So my protocol, and what Wan will also discuss, ear, nose and throat examination, widen the palate, but do it so the nasal floor drops down. And if you look at the typodont that you'll be doing, this is it here. Effectively, you'll be placing the 4 TADs on this model, and then using the new screw that Wan has designed. This one is much easier to turn. Rather than have a hole like a jack screw, you've got a little mini spanner. So it becomes almost like a super screw, like a hexagon. So after you place the 4 TADs, you'll be opening up with this spanner so you can see how much expansion is required. Wan is very, very good in explaining the clinical aspects of the technique. So I want you to understand, this is not a course that you'll come to which is purely theory and then you leave thinking, oh, that's a great idea, but now what do I do? Here, the actual appliance design, the fitting, the adjustments, complications, which cases not to use it for, it's all covered very succinctly in a one-day course. So if you're doing any form of airway treatment for your patients, either as children or adults, or if you want to minimize the need for extraction by developing the palate, or if you've got a child who's a little bit too old for face mask therapy, with this technique you can push the upper limit of bringing the maxilla forward using this with a modified hybrid hook for the face mask. And Wan goes through all these cases in detail. He's a wonderful speaker. I've listened to him many times. He's in big demand on the world lecture circuit. So, you know, it saves you having to hop on a plane and go to UCLA to actually hear him here in Australia. So we're very excited. The course is limited because of the typodont exercise, right? So it's not as though you can show up at the last minute. I know a lot of people that do EODO courses just assume there'll be spaces available. I can tell you this course is already half full, and I think by the end of the year it'll be oversubscribed. So please get in early and contact my staff at EODO. I look forward to seeing you at this course and sharing this wonderful technique with you. And just recalling, the date is April the 19th. It's a one-day course, but it's a long day because it's the lectures in the morning, the hands-on in the afternoon. You'll love it. I'll see you then.